Hello everyone, welcome to our chat show. I am Dr. Nupur from Well Women Clinic and we have with us Dr. Puneet Rana. So Dr. Puneet Rana is an IVF and reproductive medicine specialist trained in United Kingdom. She has an immense experience in treating fertility issues, both male as well as female, and is an internationally trained specialist. She will discuss with us male infertility today, which is our topic for discussion. We know that male fertility is a problem world over, and lot of times it remains undetected, unrecognized due to various issues, social taboos, stigmas in the society. But let us reflect on what is male infertility. So welcome, Dr. Puneet.
Thank you. Thank you so much, Dr. Nupur.
So Dr. Puneet, can you tell the viewers that what do we mean by male infertility?
So thank you, Dr. Nupur. As you rightly said in the beginning, that infertility is a problem of both male and female. But due to some social reasons, it's more underdiagnosed. And hence, it's very important to reflect on the fact and bring it awareness that male infertility can also be a problem and can lead to failure to achieve pregnancy in a couple. So as the name indicates, male infertility, any problem arising in male, for example, in semen reporting, is what we called as male infertility. Looking at the incidence, it can account for approximately 15 to 25% of the cases of infertility. So when a couple comes to us, we should not ignore this and we should treat or diagnose male as equally as a female.
Yeah. So yes, we need to take this into account when we are evaluating a couple for a fertility issue. So are there any of risk factors or any factors that will determine that these males are more likely to have fertility problems?
So yes, as any fertility, whether be it male or female, with age, the fertility declines. But, males are blessed that they don't have a decline so soon. But after the age of 50, 55, the male contribution obviously declines to pregnancy. So age could be one of the factors. Second factor could be lifestyle, excessive smoking, excessive drinking, late sleeping, not kind of exercising frequently, not unwinding yourself can lead to alteration in the semen parameters. And thirdly, any associated medical problems like diabetes, any medical problems like association of cancer, because nowadays the incidence of cancer is rising. So any cancer leading to involvement of chemotherapy agents, because these chemotherapy agents can cause male infertility. So a detailed background history is very important when we see such couples so that we can delineate the exact cause of male factor.
So does occupation also play an important role?
Yes, that's a very important point as well. Males, especially working in high heated situations like, coal industries or furnaces where it involves high heat, can have association of abnormal semen parameters and hence leading to male infertility.
So how do you evaluate a couple to know about the male factor?
See, the most straightforward and simple way is to check on the semen, what we call as semen analysis. So in the semen analysis, we see certain parameters which help us to screen whether there is a male problem or not, starting from its consistency, how the semen looks like, assessing its pH value, assessing its viscosity, how thick it is, and then looking on the specific parameters like what is the number of sperms in the sample, what is the motility of a sperm, and how does the sperm look like, which is the morphology. So these parameters helps us to decide whether there is a male factor or not.
So yes, and lot of times people come to us saying the report is azoospermia, it is oligospermia, it is teratospermia or teratozoospermia. So can you let us know what do these terms actually mean?
So from pregnancy point of view, there are very important three parameters which one should look for in a semen report. One is the number of sperms. Now we kind of take standard as a WHO with which we compare our patient reports. According to WHO standard, a sample which has less than 15 millions per ml of sperm, we call it as oligospermia. Oligo means less. So when the number is less, it is called as oligospermia. Now there is a terminology what we called as asthenospermia, when there is a decrease in the motility, because we all know that the sperm has to travel a long distance in the female reproductive tract to reach the site of fertilization. So when the motility is less, we call it as asthenospermia. And by less, I mean when the total motility is less than 40%. Teratospermia is a condition where there is a abnormality in the morphology, how the sperm looks like, because sperm has a certain structure. It has a head, it has a middle piece, it has a tail. So the morphology assessment helps us to know whether there is a teratospermia or not. So that's why it's very important that these parameters are assessed in a good lab. Sometimes, the labs are more pathology and microbiology oriented. They may not be able to give this test rightly, but doing it in maybe a fertility lab helps us to kind of analyze these samples in a much better way and give a better diagnosis.
So when the report shows a low sperm count or a low motility, and you need to evaluate further, and sometimes you tell them to go for a scrotal ultrasound or hormonal parameters. So how do they actually help you?
So when the sperm parameters do not meet the standards, what we are looking at, obviously a patient would like to know what is the reason, and we as clinicians also like to know what could be the reason, so that we can start appropriate medical treatment or surgical treatment. So to help us to find those causes, a certain number of advanced tests are done, which are mainly hormonal tests like FSH, LH, testosterone levels, alongside measuring the testicular volume where the sperms are made. And this is done through a scrotal ultrasound. So helping kind of knowing through this test, we can kind of analyze whether the cause is what we called as a pre-testicular cause, testicular cause, or a post-testicular cause. So we kind of divide the causes into three parts, whether the cause is mainly in the production of the sperms, or whether the cause is mainly the factors which cause the production of sperm, or whether it is post-production where the tract which is carrying the sperm is abnormal. So all these tests help us to find the right cause so that we can treat it rightly.
Is there any role of doing anti-sperm antibodies?
Now that's a very kind of a good question, but still a controversial question, right? Because when we find a sperm count which is not adequate, the first thing which goes into the head is somebody hitting these sperm? And first of all, it comes as, is it your own antibodies, right? Because we all have antibodies which act against external pathogens, whereas sperm is not considered as an external pathogen, it is your own production. So there used to be, a kind of an era in science when these antibodies were done quite commonly. But I would say in the current era, our understanding of these things is becoming better. So we no longer recommend anti-sperm antibodies at this stage. There are more advanced tests like fructose test, viability test, testicular extraction of sperm test, which we do to find out the exact cause of the abnormal semen parameters.
Yeah. So, and what about the sperm function tests? Are they still being done?
So again, as science advances, our understanding becomes better. I would say in the current stage, sperm function tests are not much recommended. But yes, in the past, they were became into a use very commonly. And the reason being, with the advent of the reproductive technology, Now we have IVF ICSI, which gives us a better result than these sperm function tests. So their use has become less. But yes, patients who really, really want to try naturally, then at least in those patients, we can consider doing these tests. But again, if they come abnormal, the treatment is through the advanced reproductive techniques, which is IVF and ICSI.
So do you in your practice also see males having sexual infections or maybe STI or RTI, and does the treatment really help in those conditions?
Yeah, so infections, for infections like, HIV, hepatitis, sexually transmitted diseases, I would say washing the sperms and then putting these sperms directly into a female uterus really helps to kind of meet the kind of, I would say, helps the couple to achieve a pregnancy. And because we know over here that the carrier of these infection is the seminal plasma. So when we do IUI, we remove the seminal plasma, which is the source of infection. We just wash it and put only sperms inside. So the risk of infection really decreases being transmitted to the female partner. So I would say for infections like STD, intrauterine insemination after washing the sperms is a very real way forward to achieve a pregnancy for an infertile couple.
Okay. So thank you so much for highlighting these important measures. And last but not the least, is there anything the male partner can do to prevent or maybe not suffer from male infertility?
Yeah, so again, I think we live in an era where we all talk about preventive health. And I think this question is really important again for the male infertility as well. Like I said initially, that doing a semen analysis is a very simple way of knowing your fertility health. So maybe, like we say, yearly health checkups. It'll be good to kind of keep an eye on the semen analysis and doing it regularly. Above that, I would say maintaining healthy lifestyle and the factors which can cause abnormal semen parameters like smoking, drinking, inactive lifestyle, eating too much junk food. If we can avoid that, that would be wonderful. I know we live in a stage where it's not possible to completely stop, partying and going outside, but at the same time, giving a balanced lifestyle where we incorporate physical activity, yoga, meditation into our daily lifestyle will help us to kind of prevent abnormalities in the semen parameters.
So thank you so much, Dr. Puneet, for highlighting these important things, which will make a big difference in the lives of people who can listen to you and take your guidance. And so see you soon again with maybe another topic which our viewers would like to know. Thank you.
Thank you. Thank you so much.